Pediatric intestinal failure by Carla Grau Muñoz. Definition: intestinal failure in infants and children is a devastating condition that can be broadly defined as the inability of the gastrointestinal tract to sustain their life without supplemental parenteral nutrition.
Hi everyone, today I decided that I am going to start a mini series. So I'm going to be talking through my medical conditions as videos because the ones that I am comfortable about talking about on the internet. I do have one or two that I'm just coming to terms with by myself and I'm not ready to talk about yet. But the ones that I am ready to talk about, I'm going to be making a short video series explaining what they are and how they affect me, because I recognise that when I'm writing blogs, and my blog is in the link in the description if you're talking about how these things affect me, or I use a shorter version or a different name or video series. So my first video, as you'll be able to tell by the title, is what is intestinal failure? So for me, this means that I have severe dysmotility. I have a glitch in my brain whereby my brain isn't sending the right signals from the top of my esophagus right down to the end of my bowel, and this is causing dysfunction. This is degenerative and this will possibly get worse. We don't know how quickly or how slowly this is going to happen, but in the last 2 years I have noticed a deterioration. So for me, this glitch is that the nerves aren't responding correctly to signals in the brain, so things aren't moving along around the bowel and the stomach as they should. So if this is your stomach, you have a muscle called the pylorus, and all your food must travel through the pylorus, which is a muscle that opens and shuts and down into the bowel. Now my stomach doesn't work at all anymore, which has been quite a huge thing to come to terms with, because the pylorus doesn't respond properly. Now I have a feeding tube that goes in my stomach, down through the pylorus and down into a little tiny bit of the bowel that is still working for me. I use a feed pump to regulate how much I have an hour because my bowel struggles with volume and processing. All of these have
Application in medicine. Children with this sickness were exposed to multiple classifications of medications: oral antibiotics for bacterial overgrowth, histamine blockers, and proton pump inhibitors were each given to over 50% of patients. Infants where IF underwent a considerable number of abdominal procedures. Numbers represent all abdominal procedures could be performed from birth. Multiple abdominal procedures could be performed during a single surgical operation. Patients received a longitudinal intestinal ladling and tailoring procedure, serial transverse enteroplasty.
Short bowel syndrome, or SBS, is a rare gastrointestinal disorder where you can't maintain nutrient and fluid balances with a normal or SBS is a rare gastrointestinal disorder where you can't maintain nutrient and fluid balances with a normal diet. SBS occurs when a large portion of the intestine has been removed by surgery, or when there is a loss of function as a result of other disorders. If you have SBS, you can no longer absorb enough fluids and nutrients from liquids and food you digest to maintain good health. It's known as malabsorption, which means a risk of malnutrition, diarrhea, and dehydration. SBS can have a negative impact on quality of life because it restricts or alters a person's lifestyle. However, with the right treatment and disease management, these restrictions can be eased. When SBS is severe, sometimes diet and drug therapies aren't enough. We call this SBS with intestinal failure, SBS-IF. If you have SBS-IF, to survive, you'll need intravenous nutrition and/or fluid support. This is known as parenteral support, parenteral nutrition, IV nutritional fluids, home parenteral nutrition, and total parental nutrition. All these names may seem complicated, but the main point is we have to add important nutrients and fluid via the bloodstream because they're not absorbed in the gut. Parenteral support is usually administered for 5 days per week on average, ranging from 3 to 7 days, typically overnight. This can lead to sleep deprivation because of the need to visit the toilet or discomfort from the process. What's the goal in treating SBS? If you have SBS-IF, alongside therapies treating the effects of malabsorption, your doctor will aim to allow you to lead as normal and independent a lifestyle as possible and enable you to continue to do the things you enjoy. A doctor's ultimate goal in treating all people living with SBS-IF is intestinal rehabilitation, which means significantly improving absorption in their intestines. Then they might be able to reduce and ideally eliminate dependence on parenteral support. Want to know more? Visit shortbowelsupport.com for more information and resources.
Here we're gonna go with pros and cons. Pros and cons. The pros of pediatric intestinal failure is that these have a lot of surgicals. Mortality has decreased from 30% of patients over 5 years to 10 to 15 over 4 years. Reflects the impact of multidisciplinary intestinal rehabilitation programs on patient outcomes. Cons. The infants and children with IF are at the risk for immune complications as well as death. Human and societal costs for these rare conditions are substantial. Long-term use of PN can be complicated, and this has several conditions that include sepsis and chronic liver diseases. Children with IF are at risk for multiple morbidities, including metabolic derangement from gastrointestinal electrolyte losses, mechanical and infectious complications of central venous catheters, structural and functional bowel disorders, missed school, and lower quality of life. Well, I'm going to show you a video that reflects this.
Intestinal failure is an inability or compromise in our GI tract's ability to perform its function. For instance, if there is a reduction in the length of our intestines, or if there's inflammation or inability to absorb and maintain the adequate amounts of proteins, electrolytes, fluids, and calories. Certain complications associated with poor nutritional intake or inadequate nutrition includes compromise in the immune system, inability to grow, muscle wasting and atrophy, inability to maintain really the function of the organs throughout the body. The body's functions can start to cannibalize itself, and that's why we see people who are starting to use up their own internal stores to the point where they are unable to maintain just regular bodily functions. Sometimes intestinal failure is diagnosed by the knowledge beforehand that there is a shortened length of small bowel, or after one has actually undergone multiple surgeries, or severe inflammatory disease. There are several outcomes for a patient with short bowel syndrome or intestinal failure. For the lucky ones, they have adapted to the shortened bowel and had compensatory growth and increased absorption. You also have patients who have intestinal failure and require supplementation with IV nutrition. One of the fortunate developments is that there's ongoing research as well as recent developments in the care of these patients. Even in our own anecdotal experience, we've been able to either reduce the amount of time that somebody would need IV nutrition, or even sometimes wean them completely off IV nutrition. There are also surgical techniques that can be utilized for this disease. For instance, we do have experience with bowel lengthening procedures using your same segment of small intestine, and by cutting it in a zigzag fashion, you can create an elongated segment of bowel. And then there's also the option of small bowel transplant from a donor. There is very emergent research on the potential use of stem cells and the development of artificial organs created on a scaffolding with stem cells. In the presence of a shortened bowel, there are certain foods that become a little bit less tolerant than if you were to have a normal length bowel. So we may include a dietitian and nutritional therapies. There really isn't a magic bullet to really address the problem. It's actually a complex interplay of the different nutritional, pharmacologic, and also lifestyle changes and strategies that actually together provides improvement in the quality of life. And that is why a multidisciplinary care of the patient is actually very important to provide the best quality care in this very complex disease.
This should not lie in Ecuador. In Ecuador, none presents a lot of this restaurant, but when these presents are more difficult to cure. In statistics, the numbers all represent all abdominal procedures performed from birth. Multiple abdominal procedures could be performed during a single surgical operation. There were 26 children who underwent 28 bowel lengthening procedures. 11 patients received a longitudinal intestinal lengthening and cesarean procedure. 13 received a serial transverse enteroplasty procedure, and 2 children had both a step and a longitudinal lengthening procedure.
A nutritionist in the United Kingdom, and I'm going to be talking for the next few minutes about chronic intestinal failure, but specifically the chronic intestinal failure that's not associated with short bowel syndrome. It's important that we think of this as intestinal failure is a functional diagnosis, not necessarily a structural one. We have many patients now where the problem is related to either severe inflammation or even more often now, a problem with motility, such that the intestine doesn't function, even though its anatomical length may be relatively normal. This group of patients is very different from the short bowel patient, because they don't have the problem with massive fluid loss and a need for daily fluid replacement necessarily. But they equally do often have a lot of problem with abdominal pain, and that can limit their ability to eat. So that these are the patients who not only have intestinal failure but also have a problem with eating, where eating is painful. Partly because
Conclusion. This is a complicated sickness that needs more attention and needs surgery and different antibiotics. But they are not in Ecuador. That like the surgical back of the bowel with stem cells. But there are other treatments that can do to injure patients, like pharmacology and surgical by lengthening the bowel.
Hi, my name is Dr. Tanya Hoffmeckler, and I'm the current Director of Intestinal Rehab of Children's at Eggleston Hospital in Atlanta. And I'm going to talk to you today about intestinal failure and G-tubes. So first, let's answer what is intestinal failure. Intestinal failure occurs in children whenever their intestinal tract does not function enough so that they can either grow or stay hydrated by using their regular GI tract. So intestinal failure can happen if, for example, a large section of the intestines is removed and then a child has something called short gut syndrome, or if for some reason the intestinal tract simply does not function the way we expect it to function. This may mean the intestinal tract does not move food through it properly, and so the child can have an underlying motility problem. Or if, for example, the intestinal tract does not absorb the proper nutrition through it, and then the child may have diarrhea or simply cannot grow and thrive by using their intestinal tract or relying solely on the intestinal tract. So before we speak about G-tubes, I want to talk about parenteral nutrition very quickly. So whenever a child has intestinal failure, we as physicians have to rely on something other than their intestinal tract to provide the nutrition and hydration and calories. So that comes through parenteral nutrition. Parenteral nutrition is essentially calories and fluids that we can give by an IV to the child or to whoever needs it. Unfortunately, there are many complications with parenteral nutrition. As an example, you need to have a special IV that's placed into your skin and ends up close to your heart, and that's the way that the parenteral nutrition is given. Just having this catheter in has a lot of risks to having sepsis and getting infections and having to be admitted to the hospital. Also, parenteral nutrition can cause liver complications.
Thank you. And that was all I wanna show you about pediatric intestinal failure.
So, the whole premise of treating patients with intestinal failure and short gut is to try to eliminate the parenteral nutrition and give nutrition other ways. And that's
Thank you.